It is the go first.
Hello and welcome to the Bodi program. This is Natidian Africa Media and I am Hanafumike Mcormack. Bodi they come to una from Tidian Africa Media. Today they talk about different kind of sicknesses them where they all over the world. Adena today in the studio with Dr. Mohamed Yayah. Good afternoon, Doc.
Yeah, good afternoon, Anna.
Doc, you can tell Fambul them who that you be.
Okay, thank you very much, Anna. Good afternoon, Fambulem. Me, as Anna just rightly mentioned, me na Dr. Mohamed Yayah, and currently I work na Connaught Government Hospital. Me na a resident, or the British system will say registrar in internal medicine. Okay.
Okay, so Doc, what do you get for we today?
Okay. Today we talk about diabetes. We know this na a condition where it only hamburg with people for so long now. Diabetes na a very, very common sick. Now we environment and the globe at large, that the whole world. Diabetes is hamburg people so much. So first of all, we need to try to understand wetin na diabetes. You know when you say diabetes, all man they say na that sugar sick. So basically, we get other diabetes we not get anything to do with sugar per se, but in get to do with something like the water, how the body they deal with the water in the system, we then call diabetes insipidus. Instead of get the name diabetes because of the reason being you dey pull too much water in the system, meaning you dey wet fast, you dey pass urine fast. You dey also get urge for drink water fast, that is thirsty. So basically, I make himself name diabetes. But in diabetes, as I say, you get to deal with how the body they deal with water in the system. You go lose too much water in the system. That's now diabetes insipidus. But not only na the topic of discussion this afternoon. The topic of discussion this afternoon is what we call diabetes mellitus. When are the condition we actually deal with the sugar sick in the body. So, first of all, what is diabetes mellitus? Diabetes mellitus basically na a condition wherein person get problem with sugar. Now, the body, when you eat food, the body, they make it in a way that, it design in a way that the food we eat, you get something then at the body, we call hormones, where they take them thing and they transport them in a different part of the body. So diabetes, now in a state with, wherein the thing where they transport the sugar, we call insulin, it gets problem. You get one of two problems. We get one problem where in the body, they produce that insulin at all not. The part of the body they produce this insulin, we call it the pancreas. It ain't not the body. Just like how we get we eye, we get we ace, we get we nose, this we get we liver, we get we kidney, we get we heart, now so back we get this pancreas. One of in function now for produce this insulin, we are the hormone responsible for transport this sugar to different parts of the body, like the muscles, the liver, etc. Now, if this pancreas not produce insulin at all, you go observe see this insulin, this sugar, when the insulin for transporter, it go pass mark na the blood. So the sugar go stuck, they move for go outside in destination. So that time that person they don't get to thing called diabetes mellitus. Then they now one form of diabetes, what we call type 1 diabetes. And most times they occur with people, small people, young people below the age of 40. That's not for type 1. In a condition where no insulin, the body may produce no insulin, or the amount of insulin so small. We get the other type of diabetes, when are the most common one, especially in this week country, Salon. And this type of diabetes, the body they actually produce insulin. That the pancreas, they actually produce insulin. But the problem where we get this insulin, it gets, for let it transport this sugar, the insulin suppose for pass through. Now, it gets in where they domot the way for pass through. Then domot because of the problem don't happen, then domot they need to respond to the insulin. So in that case again, you get insulin, but the insulin not able to transport the sugar full under the blood and go to the destination the way for go. So in that case, the sugar also will increase in the blood. That condition now diabetes mellitus type 2. This one, like I say, we get insulin, but outside the gates there for let the insulin take transport the sugar, it doesn't respond to the insulin. It dey, but response not there. So that again will make you develop diabetes. And this diabetes, type 2 diabetes. Now the most common one now surrounding. Once you all understand about this diabetes, now more they affect people with above 40 years. Some can say above 45 years. Okay? So basically this now follow understand what now diabetes and the most common type of diabetes. We also get other form of diabetes there. We're not too common. We get one we call pre-diabetes. What now pre-diabetes? Pre-diabetes, now in the case we are in, we then check your sugar high, but it's not actually high for let them tell you say you get diabetes. Now high sugar, but you not reach diabetes level of sugar. So then go say pre-diabetes. We also get a form of diabetes we call gestational diabetes. Gestational diabetes, they only occur to belle woman. Any belle woman, we don't reach 20 weeks. It don't complete 20 weeks by belle we get. It don't develop diabetes. We then check an hospital and go say this person gets gestational diabetes. Most times when deliver, that's why don't born the pikin, the sick they go. That's the diabetes they resolve for himself. You don't need medicine anymore. So that is gestational diabetes. Now they talk about we then check your sugar is high, we then check your sugar and not reach that level. Waiting at this level they talk about. We get two form way to check sugar. We get the one we call fasting blood sugar. Now the form of sugar we they check, wherein you know they eat. You they fast like throughout the night. Say do clean. When you grab in the morning, you don't eat anything, even water safe. You know drink not to mention for say you don't drink, then sugar drink, then you don't drink anything. You can at the hospital, we check your sugar. We check your sugar. If your sugar dey anything above 7, some can even say 6.9, some can put out 7.1. But we understand this. This one, again for the sugar level, we get different form. We get the one when they are making system, we then they use when a milligram per deciliter. We get the one when the British system when a millimole per liter. The most common one who they use in this part of the world, Salon, a British colonized country, now the millimole per liter. So now I make a dimension then small figure there. For the people that use their making system, you go every figure like sugar not for the below 130. That's not for the fasting. Okay? So then they're very important for you to know the difference. If that sugar they will then check and that the fasting, you don't eat anything, they ask you don't eat, you say no, I don't eat since do clean. Then check your sugar, it day less than 6.9 or let's say 7, then none in a normal, no problem. But if you day above that, maybe they 7.5 or 8, something even go above 10 self, fasting blood sugar greater than 7, that person go then go say he get diabetes mellitus. Okay. We get the other form of sugar who they check, we now what we call random blood sugar. You go come visit a hospital or a healthcare unit, you say you want to check your sugar. Then check your sugar high. But they ask you don't eat since morning. You say yes, you don't eat. I eat this morning, self, I don't eat breakfast. They say, oh, okay. That means they're random, not to fasting. In get set in your limit. In your limit, basically in a 11.1, not to the 7 will be the condition. In a 11.1. If the sugar day above 11.1 for the random, we will say na diabetes. Okay? But for the making system, you go look at the value of 180 milligram per deciliter. Okay? Now, this sugar level, we get other level where we can get a range, what they look at. Like we say, we get what we call pre-diabetes. The pre-diabetes, na sugar way high, but like we say, it not reach the level, like they above 11.1 for random or above 7 for fasting. Okay, so what they talk about the sugar level them, basically in the range then we mean. Okay, we don't discuss about the main types of diabetes. We say we get type 1, we get type 2 diabetes. We say the type 1, and they occur to people way younger. That's people already less than 40 years of age most of the time. Okay? And then people and they can bond with the problem. And we say them people and they not get insulin. The body they make insulin. When insulin is responsible for transport sugar from the blood to different parts of the body. That's for type 1. We talk about type 2, we say for type 2 diabetes, in a form of diabetes, where the body actually they secrete or they produce the insulin. But the side way for transport the insulin, they don't respond to the insulin. For transport the sugar, they don't respond to the insulin. So the insulin actually available, but like it's not working. The body not sensitive to them. So that's also a diabetes when type 2. And this type of diabetes, we say they occur to mostly people above 40 or above 45 years, when are the most common type of diabetes now is surrounding. Okay? And he also deal with people that will get body. For type 1, you see find out most of the people get type 1, they're small and kind of lean. We check them body mass. Whereas for the people that get type 2, now then people will get body. They say, hey, this is fats. And then people can get type 2 diabetes. Okay. We also don't talk about gestational diabetes, who say they affect the belly woman them. Okay. And the most times the stage of pregnancy where they detect them, now where the belly don't reach 20 weeks. 20 weeks basically, for low understand better, now around 5-month pregnancy. Okay. Okay. So now, what do they cause diabetes? We don't talk about diabetes. What do they cause this sick here? To be honest, the thing that actually causes diabetes is yet to be known. We don't know what thing actually causes diabetes. But medicine they evolve. People in the study every now and then. We get in the way we associate with diabetes most of the time. We call them risk factors of diabetes. So we're not going to say these are the causes of diabetes per se, but then things that might lead you to get diabetes. So now we call them risk factors. So one of the risk factors, now the one I don't mention, was pre-diabetes. Pre-diabetes, sugar is high. You know they above, let's say random blood sugar, you know they above 11.1, but maybe it is above 10. The sugar actually high. That person, because of the sugar high, they close now to diabetes. They get for advisor. They say you need for what you eat, you need for begin for exercise. Now that ending now the doctor is stepping for help and for prevent and let not go into diabetes. If you listen, maybe then they go help them. Okay? But if the person not change, if the what they do or what they eat at that point in time, you just continue no more the same lifestyle. In the down the years, that person they will develop full-blown diabetes mellitus. Okay, so then in a one risk factor, our really pay attention to when a pre-diabetes. Okay, another risk factor na overweight. Sometimes you see people then go visit hospital, then get too much weight. Then they say, this body, mama, papa, this body I will need for check and we need for reduce this body. What did they eat so? Try for modify what did they eat, lifestyle modification. We begin to say, hey, if in a person they exercise, that person if we start to exercise. Okay? Now overweight again, it gets way high the categorizer. You need just look person no more. Because of the person is stout, you say this person is just overweight. You need to work like that. Sometimes you see person, that gets that body way they look at, but it's still overweight. How will determine this? We get what we call body mass index, when at the BMI. Most times, what they screen for diabetes, and one of the things they can screen for. When they measure your weight, we relate them to your height. What measure them, we get what they look for. Now, if you're not a person, we then check your BMI. You dey below 18. You're not a person with underweight. In other words, you malnourished. You need to eat more. Okay? So we need to pay attention to the number there. That's not for the person underweight. If you BMI, we then check you under 18. Now we get other range where now you don't above 18, 18 to 24.9. If you didn't at that range, 18 to 24.9, this now the weight we will appreciate what we want. This is not the normal BMI. Where then at that range they in a normal BMI person. Nothing to fear. Just continue. If you then now above 25, this problem don't begin happen. We don't begin to say, you don't overweight too. That's above 25 BMI now overweight. Again, where you come on overweight, we get other condition where they go into in a full-blown obesity. That now the weight don't pass mark. Problem that happen. That disease don't begin setting. Your weight don't begin cause problem. Most times when people in if they not be careful and they can go into diabetes. Obesity now, that now way you don't they go now above 29 now. Okay? So basically I follow understand. Also overweight, not so you need just look person no you say overweight. You get for check what you call the BMI. Very important. The other thing when a risk factor we might lead for a person get diabetes. Now the age, 45 years. You know sometimes working list risk factors, sometimes we can say if you're a man, you get risk for get that condition. If you're a woman, you get risk for get that condition. If you age reach so amount, you don't get risk for get that condition. So in for diabetes, we don't get sex as risk factor, meaning we don't get for saying a man or you a woman. But if you age there above 45 years, now also a risk. Okay? Now, you know able for control the age. All my age, all my one leg live as long as he can. So you know what help us is say, wait, if you know they will control and okay, these are one of the non-modified risk factors. But again, at their age, then the way you reach. Now that thing they begin look at. If you not be the look at them, what they eat. In a post where they exercise, you begin check your lifestyle. In a post where they smoke, last left for smoke. In a post where they drink alcohol, last left for drink alcohol. Because you don't reach at the age, if you not be careful, they go into diabetes. Okay? Very important. The other thing also important, now family history. Now for family history, where I be mention the type of diabetes, I mentioned the main one them, I mentioned type 1 and type 2. Funnily enough, type 1 they get way small, they born with almost. But in not associated with family history. If you brother get type 1 diabetes, it don't mean say you body get that. You understand? So not a risk factor for type 1. Family history na risk factor for type 2. This is very, very important for no. The family history what they talk about are first the relative. Your parents them, for instance, your mama, your papa, they don't tell them say they get diabetes. You get for look at what they eat. It's very important. Your brother, first degree relative them, your brother, your sister, all them people in the first degree relative them. Sometimes they go tell you say your mama and brother, that na your uncle them. Sometimes you're more related to them even than your papa. How? The only person you know than your papa and your mama. Not to what in society they portray out there. It's very important to know this. So your uncle to your mama side, if you get diabetes, your uncle to your mama side, if you get diabetes, they will tell you say you back this is a risk factor for you for get diabetes. It's very, very important. Okay? So these are for family history, and for type 2. The other one, when a risk factor, now possibly we not active. How you not active? Anybody where they live when are adults, we know they exercise, or even if they exercise, but less than 3 times for the week, you know they exercise. In a possible they regard say you not active. Okay? So we need for the exercise more. We get for beaucoup form of exercise them. Free on a congested community. Sometimes before you sit down by traffic, walk at that distance, then a very good exercise for you. Okay? You can go down the beach, you walk, you do small run, and all a form of exercise is very important. Not live that sedentary lifestyle from motorcar to parlor, from parlor to motorcar to office, back to the motorcar, back to the parlor to the room. In a bus when they do no form of exercise. Now a serious risk factor for late develop diabetes. Okay. The other risk factor for late develop diabetes, we also mention what we call gestational diabetes. Gestational diabetes, as we say, na diabetes wey na belle woman dem dey get am. Now this belle woman here, e don get gestational diabetes. At the end of the day, e don deliver the pikin. When deliver, the diabetes e don resolve. That person dey, in the long run, e dey reach at a certain stage of in life, if you not be careful, e dey go into diabetes, either most likely type 2 diabetes. Because you don't already get the gestational diabetes when a serious risk factor for develop diabetes in the future. Okay. The other thing back way very important as a risk factor, na pikin way big, we dem born big pikin. Very important. Woman way born big pikin, most times that woman they begin screen am for diabetes. When they say big pikin, not so way you just watch the pikin. Then pikin, any pikin dem born in hospital, they weigh am. Okay, now one of the reasons this woman could advise, would encourage people let them not born picking a house, go to hospital for go deliver. Where deliver pikin, the way picking. Any picking where they above 4 kilograms. Now that weight system we they use as alone. Other country them they use pounds for weight. But we salon na kilogram they use. If the picking they above 4 kilograms, that comrade they get for monitor for diabetes. Then get for screen them and they tell them for letting do routine checkup in the hospital. Maybe it will go into diabetes in the long run. So then go advise them. Okay. So these are the most common risk factors of diabetes. Okay. Now, how person will say I get diabetes? How you go look at yourself say you get diabetes? Okay. It's very important. Now, for look at yourself say you get diabetes, you get things the way they pay attention pa. One of the things the way they pay attention pa say you get diabetes, or likely you don't get diabetes. Now way they wet fast. That you they pass urine fast. Maybe for the night, you then grab sometimes 4 times, 5 times, more than usual. Normally you sometimes for the night, you just wake 1 time, you pass urine, you go back to bed, you sleep. But time can reach now, you they grab 4 times, 5 times, sometimes more than 3 times, most of the time. During the day again, at the same thing that happens, you say, any half minutes no more, I feel for it. You don't go pass urine. You not possibly need for go for checkup. They then check your sugar, most likely you don't develop diabetes. It's very important. Okay. The other thing where they look for, when a sign where they look for diabetes. Now if you not possibly they thirsty fast, if they get urge for drinking water, very important. If you get urge for drinking water too much, again, na thing way for make you go na hospital for let them check you for diabetes. It's very important. The other thing again, when a sign of diabetes, now when they tire too much, you find out say, if they go to complain maybe to doctor or to even you call it, I don't know what happened no more. Then this the whole, I did tire no more. Just tiredness 90 per me. When you notice that they go to hospital, let them check you for diabetes. It's very important. Okay. The other one again, the one they mentioned so, the for wet fast, for get urge for drink water fast, for tired too much, are one of the most common signs of diabetes. Another common sign of diabetes, again, now where they lost weight no more, you know, you're able to understand. Your body just they reduce no more. They eat so, in fact, your appetite they increase. They eat more. You know they get rich. They wonder what's in that happened to me, but not so for saying a witch on a magic. Go to hospital and check you. Na sign of diabetes. It's very important. This is not the most common one then. Okay? If they get urge for it, the appetite they increase, but you need to gain the weight where you desire. Very important. Okay? Another sign of diabetes, what we mentioned, now what we call blood vision. Blood vision basically now where you are the dim. You need to see clear. Or you see objects them, or you see people them, you need to see them clear. You find out how this person here look dim na me eye. Okay, so for explain them in a simple terms, and they mean by blood vision. We get and the first thing first, you go see your eye doctor. Okay, what we call ophthalmologist in hospital. You go see eye doctor. Though the eye doctor see you, the eye doctor will also send you for let go see a physician, let them check you and screen you for diabetes. It's very important. Okay. The other thing again, where they mention when a part of the signs them say you not possibly get diabetes. if you get wound na any part of your body, whether na something na cut you, or maybe na woman if they cut plaster, in cut your finger, or in a man, you jam your foot some side, whatever way where you able to forget so foot by any part of your body, or you wound any part of your body. This particular thing a sign. When you get that wound, you expect and say you don't put medicine, or you don't go, they don't clean them. You expect and say within a short period of time, if you all well. But you find out say this thing don't go almost 1 month, more than 1 month. This wound they are not grief for well, or you know they heal. This is a sign say you get diabetes. Go to hospital, let them go check you for diabetes. Because one of the complications of diabetes, when you get wound, you need it well. Okay, but they reach that stage where for mention the complication. Okay, so if you get wound where you know they grief for well, na sign say maybe you don't get diabetes. You need for go to the hospital, let them go check you. Okay, another form back where it possible be say na diabetes you don't get. Some of them signs there, then get other disease them. You get the sign, but it don't mean say you don't actually get the diabetes. We know say no more na sign. If you go to the hospital, and they then will confirm say whether you don't get the diabetes or not. It's very important. Okay. Now, the other sign what I will mention here, now where it get numbness now your foot and hand them. If find out say, it say they get cramp too much. Me hand them place no cold, but me hand them they cramp, me foot and they cramp. Sometimes they touch your foot, they like say you need to feel themselves. This again now a sign for diabetes. So it's very important for you to know the signs them. So the moment we notice the signs then day per week, we go rush for going to hospital, let them go check we for diabetes. A very important for you to know then thing there. Like I say, diabetes is now a very common condition. Now this part of the world. In fact, globally diabetes is very, very common. Okay. Now, what I mention the signs them. Now, how we go now you go to hospital, how they go diagnose you get diabetes? I don't explain part of this thing here. We already explain, say, where you go to they check your sugar. We don't explain about fasting blood sugar. We say, you know, for they above 7 millimole per liter. They also check for the random blood sugar. We say the random blood sugar, enough for day above 11.1. It's very important for you know this. Okay? For we go to hospital, then check you for diabetes, then check your sugar. The first way they check for diabetes, always not the sugar. I want to understand this. Then check your sugar, you don't eat it, then go do fasting. If you don't eat, then go do random for you. The best one way we can always check for now the fasting. It's more accurate than the random. It's very important. Okay, because the random, we don't know what you don't eat. Maybe just before they come, maybe what you eat, now you get a lot of sugar. We can say sugar, people like if you say that ordinary sugar no. The sugar we talk about here, anytime we person eats carbohydrate meal, you get carbohydrates, whether na gari, whether na cassava, whether na fufu, whether na yams, whether na rice, okay, sometimes bread, okay. This all gets a lot of carbohydrates. So where the food can at the body they break can down into simple sugar. And that sugar they now they pay attention to. Okay? Follow understand this. It's very important. So this is now how for check. We got that way where they check whether you get diabetes or maybe you been get them, you didn't improve. How we know say they didn't improve? Then again we get to the screen for. We get to one test what they do now hospital and we call them HbA1c. Okay, this is the you see the blood, we go to call hemoglobin. Now it's responsible for transport oxygen in all parts of the body. Now they collect the oxygen from there, they distribute it. Okay, the blood we also get division of the blood. We get the red blood cell, white blood cells, platelets. They all get them function. But the one I will pay attention to the red blood cells. So now responsible for. Then they get responsible for the hemoglobin and also for transport oxygen. Now, them blood cells they are just like any parts, then they die. The red blood cells there. And the normal lifespan, basically in 120 days. Okay? If you do the math, you go see now around 4 months. Okay? Every 30 days, now 1 month. Every 120 days, they die. the body they replace them with new one them because the body they make them. Okay, the body they make them that now a different disease altogether. But the body supposed for make them and the normal trend and so what they check this HbA1c, we they track back your sugar level in your blood for the past 3 months or so. So it's very important for you to know this. Okay? Now, we'll check this HbA1c, we get value. If it is above 7%, this person here, he gets diabetes. Or in diabetes we get, he's not able to control well. That's for the past 3 months or 4 months. It's very important for you to know this. Okay? That's now the way they move check diabetes. Okay? Now, how they treat diabetes? Diabetes, if they pick up and quick from you, it's nice. It's nice in the sense, most times, the best way for treat diabetes and for what you eat, you left for smoke if you're not supposed to smoke. You left for drink rum if you're not supposed to drink alcohol. It's very important. And also, if you're not supposed to be not active, you start to exercise more. Now, the best way is for treat diabetes. What you eat and your lifestyle. Okay? So in brackets, the best way for treat diabetes is lifestyle modification. I want to understand this. It's very, very important. Okay? Now, again, you dey modify your lifestyle, but sugar high, we need for control am. Then one day we get what we call type 1 diabetes. We like then now, the body, as I mentioned earlier from my explanation, you know they produce insulin at all. That particular person, we dey give insulin. Because the insulin I know if insulin been the sugar not for the high. So that person the insulin they give. Okay? Insulin is a form of what they give the body is a form of injection. Okay? The other people they get type 2 diabetes. The insulin they but maybe they not sensitive. The body they even take and say na insulin than we give them tablets. They see some people and they put them, they see they take tablet morning to evening. The most popular medication people can take, what I go mention here, na metformin. Okay? But like I say, if you take them medication there, you know they watch what they eat, you know they modify your lifestyle, it no go help you. The best way for treat diabetes is lifestyle modification. It's very important. Okay? Now, we dey talk about what they eat, for diabetes, the main problem of diabetes now the carbohydrates, like I mentioned, the starch, food they eat. We eat them, the body break down into sugar. From there we develop this diabetes. Now, not so that sugar where they see us, where they sell that cup sugar, where they measure. That are the simple form of sugar. Where it's even fufu, they break down to reach to that level. I hope they get them. It's very important for you to know this. Okay? It's very important for you to know this. So the best way for us to modify what they eat. One of the food they way for be favorite food na vegetables. Vegetables, fruits, grains, a whole of grains. Now, Salon, God bless you with vegetables. We don't get problem with vegetables. We just know they manage them well. Now, if you go right now, them market them, mango in time now they pass. Now, so you see mango, then scatter. Sometimes 3 months time, for they look for mango, pass you go to supermarket. If you not possible, we not able for afford, pass you say mango season come back, which is sad. Then food then they them for day 24/7 round the year. They for always do for able for preserve them. Mango not the only fruits they will do. We get other fruits then. We get grapes and all. We get lots of other fruits then. Who they eat, okay? Vegetables, of course, then they all around. Okay, leafy vegetables, then they most times people let them say vegetable, na salad no more they think about. Okay, na form of vegetable, we got other vegetable then. Okay. Then they for people we want to modify their lifestyle. Even if you not pre-diabetes or you not even get diabetes self, you try for the eat vegetables. Try for the eat fruits, a lot of fruits, it will help you. Okay. And reduce the amount of fat we eat. It's very important. Yeah, most times you see people and they pay attention. Even fish, they prefer the fry one. Now fish now for fry, chicken na fry they fry. cake na fry, plant all the food them. If they're not fried, they need it for eat them. It eat too much oil. So then they not to see way healthy, you know, go fine for we. Okay? It's very important for we know say for reduce the amount of fat we they eat. Meats sometimes also if I follow watch them and reduce them. They don't say not eat them totally. Okay, but for reduce the amount of meat we they eat. Like I mentioned, if you're not supposed to smoke, avoid smoking totally. Even for say, okay, la just smoke the 1 cigarette per day because then say la reduce me smoke. Not reduce and stop them. Avoid them totally. The other thing again we find fully avoid. Now you if you're not supposed to drink alcohol, stop them. Not reduce them, stop them. Some people they drink alcohol, but now occasionally maybe now we then go per program and they drink them. Even at that, stop them. Left for drink them. It's very important. And now I want to talk about the danger of diabetes. What in diabetes they lead to? Okay. Okay. So now I want to touch on another important part when the dangers of diabetes, when the complication.
Dr. Ba,
okay.
I want to hold on first now. We go for a quick break. When we come back, you will continue.
Look back in the sound. These people want to do the want to look back and all that problem. Don't say the sound. Look at the look.
Welcome back from that break. Back to you, Dr. Yayah Ba.
Thank you so much. So now, we did try for round up now. We did talk about the problem the way diabetes they go with. When are the complications of diabetes? The complications of diabetes. And this some people and now when they don't reach this stage, and they actually go to hospital say, Doctor, me I know well. They don't get diabetes now, maybe for a very long time. They need manage it well, complication don't come. One of the complications of diabetes, where would they mention? Now where they get heart problem. Diabetes they lead you for they get a form of heart attack. Okay, they get heart condition there. Serious one them. Okay, diabetes they lead to that. Diabetes also they make you get blind. They lost you sight. You need to see at all. Diabetes they cause that. Diabetes also make you cock. In other words, you need to hear. Diabetes could do damage to you. Very terrible. Another complication way now common one also now way they get kidney failure. They get so much kidney problem in our society. People they wonder why make people get so much kidney problem. One of the reasons the way make people get kidney problem na diabetes. We get other reason them, but one of the common reason them na diabetes. Okay. We also they get problem with the foods them. they find out, say, like I be mentioned, when I sign, a complication. You dey get numbness now. If you need to feel the food safe, you need to feel the food, you need to feel your hand. This all a complication. Another complication of diabetes, where you wound, you need to well. You go dey say at the end of the day, you go to hospital, doctor will tell you, say, this foot here, it look like you need for do amputation, meaning for cut am. If you not cut am, this it go spread till they kill you. So pass to cut am, lay not spread, lay not continue for spread. Okay? It's very important for you to know this. These are the complications and the danger of diabetes. Now the reason that they make we get early signs, rush to hospital for let them go check you for confirm and then start for treat you as early as possible. Okay? For prevent diabetes now, how they prevent diabetes? Diabetes for prevent them, just try to understand the risk factors. You modify them. Like we say, avoid smoking, stop them totally. Now one way for prevent them. Left for drink rum, not take alcohol. Again, watch your weight. Okay, if you're not possible, you don't overweight now, looking at your BMI, you're not possible for try for watch your weight. Watch what you eat, exercise more. Okay, you get for go na gym. And not for go SINO. People who say go na gym, then visit for go stout, go begin to go build your muscle. A lot of other things in the gym, when are some simple exercise they were very, very beneficial. Okay, it's very important. If you're not possible, you get first the relative, what I will explain, we get diabetes. Watch what you eat. It's very important. Because it's possible say down the line yourself will develop diabetes. Very, very important. Okay? So if I can mention for diabetes, this is a summary. Okay, this is not like saying a detailed description of diabetes mellitus. It go deeper than this, okay? But because of time, we're not going to explain everything at this spot, okay? We'll get time again, we will come. Maybe we'll get a question and answer session where things and the way people want to clarify, then go ask. From there, we go respond, okay? But the last word where I go try for end up with, diabetes na a very common sick. If I'm bullying, our we be careful of this condition. So we watch what they eat. We'll get small problem, we go to hospital. I don't mention the signs the way they look for. Go to hospital. No begin the prepare doctor yourself. No say let that nurse can drip for you. Go to hospital, let them go check who's sick where you get. If na diabetes you get, they don't detect that earlier, then go advise you appropriately, and if na medicine, then go give you, let's start for taken. So, if I'm bullying, thank you.
Thank you, Dr. Mohamed Yayah. Thank you so much for this educative information where you don't give it. I believe say plenty people don't learn today wetin diabetes they all about, wetin the cause them, and some of the preventive measures them we for put in place for help with this sick. We thank you. Well, family, we don't come to the end of this program. We don't come to the end. I also want to say a very big thank you to we viewers them, the people that will join with today for this program, and even the one that will not join. I appeal to una all, make una go follow we on all we social media handles them, Facebook, TikTok, and on YouTube at TDN Africa Media for get a recap of this educative information. So do ya I appeal to una make una go subscribe and like them videos there. And also I talk to the one them way they watch, we make una not forget say every Monday 3 p.m. now can get the Well Body program. Make una not go forget for tune in. Now not forget again, this na TDN Africa Media and me na Mcormack.